I grew up in Berrien Springs actually and was raised there and went there all the way through college. So this is home to me. There's no place like home. So I went to medical school in Loma Linda, California. It's in Southern California, and then I went to University of Wisconsin in Madison for residency. My goal as a pediatrician is to help each individual family go through all the stages of a child's life and guide them through each one of those stages, helping them with the happy times like the first steps and being able to celebrate that with them, but then helping them with the hard times too, and when the kid is having behavioral problems or is really, really sick, and helping them through those transitions too, but being able to take them, from infancy all the way through adolescence. I think I actually knew I wanted to work with children before I actually knew I wanted to do medicine. Since I've been young, I've done things with kids. I worked at Fly Camp here in Berrien Springs. I lived for a year volunteering at an orphanage. And so I knew that my life, I wanted to do something with kids. And then when I went to college and discovered more about medicine and the human body and how intriguing that was to me, it was the only thing that made sense. I think one of the most important qualities is a physician who will really listen. Often the medical decision, it can be very straightforward, but all the anxiety and worry that goes into that. And so having a physician that's able to listen to those concerns and address those in a way that calms those fears, I think is one of the most important things about finding a pediatrician. Well, I like seeing kids of all ages. I like seeing the newborns and, helping the, moms go through the first nervous few months. But if I had to pick one group that I like most, it's adolescents. It's such a time of transition from being a child to becoming an adult and figuring out who you really are. And there's a lot of bumpy patches along the way, but to be able to be there for them, to be a constant adult who isn't judging but just wants to help them make that transition as easy as possible, it's a huge privilege, and I love. I knew from pretty much the moment I moved to medical school that I wanted to come back here to this area. And so when I saw that there was a job offered here, that was a natural, something that I was going to look into. There's some beautiful beaches, and I am one of those people who actually loves the snow and playing and going out there and snowshoeing and cross-country skiing and all of that. But what I really love about this area is just the people. There's a sense of warmth and community in every town that you go in, and I've really enjoyed coming back to that. I really love my job. Every day I get to work with kids and see them grow. And, even if you have those harder days that are long, a kid will give you a high five at the end of the day, and it just makes my day. So I feel so privileged to be able to work with kids just every day.